Hi, I'm Jude, and you're watching at Jude Reborn Girl. Welcome back. Thrilled to have you here. Want to have a great discussion today about something that many of you seem really concerned about, and that is having a smoother recovery post-facelift and the swelling issue. I had 5 facial plastic surgery procedures in February of 2023. I had the Necklift, Deep Plane, I had Deep Plane Facelift, I had the Liplift, I had the temporal Browlift, and I had a slight revision of an upper bleph. And I had it all done in 4.5 hours in my doctor's office, Dr. Jean-Paul Uzzi, and he practices in Jupiter, Florida and Palm City, Florida. He is fantastic. And I went into the procedure at 69, sort of looking my age, maybe looking a little older because my face had pretty much fallen the prior year. And I came out looking, well, you be the judge, decades younger. Now, when I first came out of it, obviously I didn't look, like I look now, but because I had local anesthesia and I just took Valium and he shot me up with some numbing shots, I didn't wake up and feel terrible. I wasn't nauseous. I wasn't drugged up. I woke up. I wasn't really swollen at that time. I was able to see myself looking pretty good, looking pretty young. I could see the difference right away, which I think is a real big benefit from those that have general anesthesia and you're in a recovery room and then you wake up and you're shuttled to another place and you have nurses and you have drains. I didn't have any of that. I woke up, I had some Band-Aids, I had my head wrapped, and I looked pretty good compared to 4.5 hours prior. So I went into my recovery with a really positive feeling. I think that makes a big difference. My doctor was not urging me to, avoid mirrors. My doctor wasn't telling me I was going to look bizarre or like a Martian. But when I read the posts by people in a number of facelift groups on Facebook, the anxiety about what their face is going to look like. They were told, don't look in the mirror. The doctor didn't explain the various stages that you would go through. So I want to shed some light on all of that today. And I want to tell you, when I did go through the stages, we all go through them after surgery. What did I do that I felt really helped the recovery to sort of move along? And what did I use or take that helped to minimize the discomfort, the swelling, or any other side effect? And so before we get into that, I wanted to just share with you that I have some expertise in the area of supplementation. And I got into supplementation about 15 years ago when I started following Dr. Russell Blaylock. And Dr. Blaylock was a neurologist for his entire career, very well known, very renowned. And while he was in neurology, he started a nutritional practice. After 25 years, he actually retired from Western medicine and neurology and pursued his nutritional practice and the study of supplementation full time. And he puts out this really great newsletter. It's called the Blaylock Wellness Report, and it's outstanding. I will put a link to the newsletter below. I read everything I can get my hands on in the area of supplementation, and I listen to everything. When I knew that I was going to undergo breast plastic surgery as well as facial plastic surgery, I put a plan in place to utilize targeted and custom supplementation to support my recovery process. I knew that I would follow the directions of the doctor to a T, but once approved, I would also put into play my targeted supplements that I knew would help my body through the process. And that's what I did. You go on YouTube and you look at what the plastic surgeons are saying about pre and post facelift. They're talking about supplementation. They're also talking about diet. Even the legendary plastic surgeon, Dr. Amir Karam, on YouTube, that has a big YouTube channel, he talks about using targeted supplements, and they actually provide their patients a little kit, so to speak. And it's all pre-prepared. You can buy it on Amazon. It is called Recovery Support Program by Via Medica, and it does have many of the supplements that I'm going to talk to you about today. So there is a groundswell of knowledge, and whether or not your particular plastic surgeon remembered to talk to you about this is sort of up for grabs. But using the appropriate herbs and natural healing technologies that are out there to support your body through the process is not new. It's something that's been around since the beginning of time. Let's talk about what made my facial plastic surgery recovery so smooth and seamless. And the most important thing is starting with a doctor that has his eye on recovery, on patient recovery. And I'll give you an example. When I had my consult with Dr. Jean-Paul Uzzi, I remember asking him about the recovery. I remember saying, when will I look sort of normal, and when would I be able to have lunch with a girlfriend? And I remember he said, well, I have proprietary methods that I use to stitch, and the way that I stitch, the materials I use to close you up and stitch, all of that, those are all proprietary, and I use them so that you're going to have less scarring, very, very little visible scarring, if any, and you're going to have a faster and easier recovery. And I was like, wow, he already has made my recovery and, my concern about scarring and all of that a priority. And because it's a priority, he developed his own practices that enable me to have a better recovery. And I remember at that point, that was one of the kind of the final points that helped me make my decision when I went back and I thought through the conversation. So look for that with your surgeon and make sure that your surgeon is really, really focused on recovery. Now, we can't avoid inflammation, unfortunately. Inflammation is something that the body goes through to help itself heal. So, what is swelling? Swelling is caused by inflammation and by fluid buildup. So, when you have surgery, right afterwards, swelling occurs in the second stage of inflammation. It's called the wound healing process or the inflammatory stage. And in this stage, white blood cells are released to the area of the wound, and they surround the area of the wound, and that causes fluid to be released. And all of that allows your body to heal. So it's all part of a reactionary process that stimulates the beginning of the healing. Actually, your repair cells can reach the wound because of the fluid and the white blood cells. So it's all sort of synergistic, it works together. So acute inflammation or swelling usually hits within the second day to the seventh day after surgery. However, in my case and many cases, they'll say to you, look out for day number 5. Day number 5 is when you're going to be your most swollen, you're going to look sort of crazy, your face won't look like yourself, but don't get freaked out. It's just, that's sort of the peak of the inflammation, and then it's downhill from there. On some people, it's day 6, some people it's day 7. Dr. Amir Karim says that with his patients, they all start looking better and looking more normal on day 6, like clockwork. But I do have some pictures that I wanted to show you of how I looked in some of those days leading up to day 5 and then after day 5. Inflammation is good. It stimulates the healing process. It's the trigger and it's part of it. However, extended inflammation, especially when it's extended acute inflammation and you remain very swollen for a longer period of time, that can actually be counterproductive. So you want to move through the swelling phases, but you don't want your body to sort of get stuck in any of these swelling phases for a period of time. Asymmetry with your swelling, or if your swelling is really lingering and it's accompanied by tenderness and redness, call your doctor. Swelling is caused by inflammation and by fluid buildup. So when you have surgery, right afterwards, swelling occurs in the second stage of inflammation. It's called the wound healing process, or the inflammatory stage. And in this stage, white blood cells are released to the area of the wound, and they surround the area of the wound, and that causes fluid to be released. And all of that allows your body to heal. So it's all part of a reactionary process that stimulates the beginning of the healing. Actually, your repair cells can reach the wound because of the fluid and the white blood cells. Many doctors will actually tell the patients during the consult that after 2 weeks you'll be able to see friends and you'll feel pretty good about it. And that's because that's the normal sort of downside of the inflammatory period. But I know for me, when I did my first videos, which was month 4, I still had some swelling and I still had some numbness. It is a little different for everyone, and I moved through that very quickly. However, when I went back and I looked at my face and my features in my 1-year follow-up, I really could see that it did take a full year for me to be fully chiseled, for my features, even my nose and my eye area, and smooth around my eyes, smooth down in the mouth area. It really took that full year to process all of the additional inflammation. Don't expect that it's going to fall off after 2 weeks, because it's not going to. And you're still going to have some swelling months after your plastic surgery, but it shouldn't be to the point where you still look like you had surgery a couple days ago. If you're in that situation, you should talk to your doctor and don't wait. So before surgery, you shouldn't drink, you shouldn't smoke. I think you have like a 2-week period, and you shouldn't take blood thinning products. So no Advil, no aspirin, no ibuprofen. The reason is they will cause you to bleed more. Smoking, constricting the veins, causes you to bleed more after surgery. And the bleeding, the excessive bleeding, causes more swelling. And that's part of why general anesthesia is more difficult to recover from, because it causes more bleeding, because it affects the veins. And if you want more information on that, watch my video up here. I'm showing it. So the other thing that we recommend are ice packs or ice therapy, especially within the first 48 hours. The first 48 hours are so critical. And I did very, very little. I mainly watched videos those first few days. I wasn't up walking around my house too much, just a little bit. But then by about day 4 or 5, I was walking around the house just to get the blood flowing a little more through my body. And then the other thing that I highly recommend is to be taking a probiotic. This probiotic, Florastor, that is available on Amazon. Now, this is so special, and I really recommend it for plastic surgery, because they always put you on an antibiotic right away. If you're not on a really good probiotic, your gut bacteria gets really devastated. It's decimated by the antibiotic. And gut bacteria and gut health can determine the wellness of your entire body. And also, as women, you can tend to get a bladder infection. I recommend this particular one, Florastor, because it survives antibiotic use. And it says that in print on the literature that comes with it. This is going to do its job even though you're on an antibiotic. And you're going to do something really good for your immune system and your overall health by not ignoring your gut. Once I got to the end of week 1 post-op, I was ready to start with my custom supplementation therapy. And these are the products I used. They worked for me. They moved my body through the various phases of inflammation and discomfort and bruising, etc. And I came through it beautifully. I had no discomfort. I did have some bruising, but my bruising is always evolving and healing, so I wasn't really worried. And I didn't have very obvious swelling. I had some, those first, I would say 2 to 4 weeks, I still had swelling, and it was a little bit obvious, partially because I have a very small face, and you have to take that into account. If you have a tiny, petite face and you have swelling, it really doesn't have anywhere to go. It's like a little chipmunk. And it was out there. However, I moved through it. I wasn't worried. I didn't self-deprecate saying that I looked like a monster. I just was so excited knowing that I was just going to go through some distinct health phases with my looks to get to the prize. And I always felt that way. I kid you not. I looked in the mirror every morning because I was excited to see the younger me every day. Even with the swelling, I could see the difference. I could see the shorter fulcrum that I had after my lip lift. I could see my higher eyebrows, even with the swelling. I could see my jaw, even though it was a little bit soft because it was swollen. I could see the smoothness of my throat, especially when I was able to take the wrap off, the head wrap. So it's really important that you stay positive and you reframe the experience as an adventure to a prize. You know, you're navigating a journey to get to a prize, and the prize is going to be your new, refreshed, possibly much younger look. And it's an exciting journey if you think of it that way. Okay, let's look at supplements that are really going to help you based on my own experience. I'm not a doctor, I'm not a nurse practitioner or physician's assistant. I'm just a girl that has studied supplements, has used them on a daily basis for probably a third of my life, and really healthy as a result. So I'm speaking from experience, and I'm just trying to help. Whatever, if it helps you even incrementally, then I'm thrilled. I hope that you will write me and tell me if you decide to engage in supplementation and how it works for you. Let's start with vitamin C. I take nano vitamin C because it's absorbed much more readily and it doesn't upset your stomach. And this is made by One Planet Nutrition, and it can be purchased on Amazon. So vitamin C is critical for wound care. We refer to it as ascorbic acid, and vitamin C is involved in all phases of wound healing. It plays a critical role because it is involved in the synthesis of connective tissue and specifically collagen. And collagen is the support structure of the skin. It's an antioxidant, so it scavenges and looks for free radicals which age you. They tend to break down the skin, they cause illness. It actually reduces the oxidative stress and inflammation on your skin and on your wound, which in turn creates an optimal environment for wound healing. And high vitamin C levels in the skin absolutely greatly assist wound healing and minimize raised scar formation. So the vitamin C can really play a fabulous role if you're concerned about how your scars are going to sell. And I will have the list of supplements in the description of the videos. So you don't have to take a lot of notes right now. You can look at that list after the video ends and after you've watched it. Okay, the next one that I highly recommend would be the Bromelain, and I get it from Life Extension. They make a really good bromelain because theirs is coated. They refer to it as etheric coating, and it's a special type of coating that will not upset the stomach. And actually, bromelain is known for greatly reducing bruising and swelling and inhibiting inflammation. You don't have to take it for a long period of time. Just take it until most of the bruising is gone. But it really is great to take it right out of the gate, and make sure that if you don't use Life Extension, make sure you get bromelain that's coated. And again, I'm not a doctor, but this worked for me. The next one that's so critical is curcumin. I use nano curcumin by One Planet Nutrition. And curcumin is a powerful master antioxidant. It regulates and really minimizes inflammation in all the phases. So this is something that I started on as soon as I was permitted by my doctor. And curcumin is from the turmeric/ginger family. So it has been used for centuries as a raw cooking ingredient, very popular in Indian and Eastern Asia. This is a fabulous product for the recovery period. And this does come in a powder as well if you prefer that. Again, I highly recommend getting it from One Planet Nutrition. And one thing about curcumin that I just love is it really does reduce pain and stiffness. So if you have a situation where a lot of discomfort and you're also swollen from post-surgery, take curcumin, increase your dosage up to, I think the maximum are 3 per day in this 500 milligram size. Zinc Picolinate. Zinc is so important, you wouldn't think it, but zinc actually supports the skin and the mucosal membranes as you heal from cosmetic surgery. Zinc will renew and repair the skin, and it has these potent anti-inflammatory and antioxidant properties that support wound healing and scar reduction. So definitely look at zinc. And the other thing is you can get zinc in your diet, so you may not need to take it as a supplement. It is available in meat, shellfish, legumes, nuts, seeds, dairy, and eggs. Some of the best things to consume right after surgery are yogurt and eggs, because they have some of these great ingredients in them and they're just easy to consume. You don't have to chew. So those two things, yogurt and eggs, should be sort of a core of your post-recovery diet, in addition to protein. Any type of protein that's easy to consume. You want to have as much protein as possible. Next is vitamin K. Now, vitamin K helps with blood flow. Many plastic surgeons have their patients start on vitamin K prior to the surgery. And the reason is the better the blood flow, the easier the surgery, the easier the recovery. And it also reduces blood clots. If you're coming up on your surgery, you can ask your plastic surgeon about taking vitamin K beforehand, and then of course following up and taking it again afterwards. The next one is nano-quercetin or quercetin. I like nano-quercetin because, again, it's part of that nano small particle family that's more readily absorbed. Now, quercetin is a master flavonoid, so it's part of the family that gives vegetables and fruit their color. And it's really an unusual supplement because it's a natural antihistamine. And so as an antihistamine, it plays a major role in managing swelling, as that's a part of inflammation. Quercetin is definitely going to help you reduce inflammation. Boswellia Serrata, again from the One Planet Nutrition, and you can get it on Amazon. All of these can be purchased on Amazon. Now, Boswellia Serrata is a tree with many branches, and it grows in India, North Africa, and the Middle East. It has, as part of it, this gum resin. And the gum resin, which are extracts of the tree, have been traditionally used in folk medicine for centuries to reduce inflammation, both topically and ingested. The resinous part of Boswellia possesses these specific acids, one of which is the most potent inhibitor of a key enzyme responsible for inflammation. In fact, research indicates that Boswellia serrata may have a beneficial influence on the various phases of wound healing, resulting in overall faster healing. And some of the things I'm citing are directly from studies. I take this one twice a day, and I did take it right after my surgery. Vitamin A. We cannot forget vitamin A. Vitamin A plays a major role in wound healing, and vitamin A has proven benefits that maintain a proper immune function and therefore help the body to recover early and faster after surgery. Vitamin A, I found when I did my research, is being recommended by the majority of plastic surgeons. It's used after all types of surgery, not just plastic surgery. And then there's our trusty magnesium. I like the life extension magnesium that is time released. I take this one and did take it daily. I think I took it once a day. It also helps you fall asleep, have deeper sleep, more restful sleep. But magnesium is a mineral that helps to heal broken tissue and reduce swelling at the same time. So magnesium should not be overlooked. You wouldn't expect it to be a key player in wound healing, but it definitely is, and it also helps you get that rest that's so important. Finally, and maybe to some most importantly, is Arnica Montana. Arnica Montana, which my doctor swears by, and we had to start taking it prior to surgery and then after surgery. It's an herb that grows primarily in Siberia and Central Europe, and it has been used to decrease bruising for years, for centuries actually. And it can be taken orally or it can be rubbed onto the bruising topically. You, as I said, you're going to start again with your doctor's blessing a few days before surgery and then continue way past post-op until the bruising is gone. So let's review and summarize the main point of this video, which is that you don't need to just passively go with some of the uncomfortable phases of recovery after facelift or facial plastic surgery. You can take an active role in trying to modulate your post-surgery period and helping it along, supporting your body, supporting your immune system. You can start on targeted and customized supplementation. And whether you choose to use everything I've discussed today or a few of the things I've discussed today, I know that you will have a positive impact on your body's healing process, and you will feel a little bit more like you're in control, which I think psychologically, is a great thing. You'll be giving your body and sort of your mind the best shot at a great outcome. Whenever you start, it's going to help, and just be patient and manage your expectations, but I wish you the best. And I'm just a comment away. I respond to every single comment. I hope you will join my Facebook group, which is called Facelift 101. Take care, be well, and have a beautiful outcome. See you on the next video. Ciao.